Hi there, my name is Gráinne Donnelly and I'm the lead author for the clinical commentary Beyond the Musculoskeletal System, considering whole systems readiness for returning to running postpartum. This clinical commentary is such an important piece to really help clinicians apply a whole systems biopsychosocial approach to their clinical evaluation of a woman looking to return to running. As clinicians, we all apply and work within the biopsychosocial model of care, but oftentimes I see clinicians considering the bio, the psycho and the social aspects, but not really seeing how they each relate to each other and not bringing it together to understand the whole picture in order to decide someone's readiness. The musculoskeletal recovery postpartum is a really important consideration, and it tends to be the cornerstone of rehabilitation and clinical evaluation within physical therapy. What I want to really focus in on is all those wider considerations and just how much they might impact someone's physical and psychological readiness to return to running. We take you through several factors from body mass to sleep quality to energy levels postpartum. And if we consider the population we're speaking about here, how many moms do you know that are getting a good night's sleep, that haven't put on weight after having a baby, and who aren't just going into survival mode, eating on the go and not getting their own nutritional and physical and psychological recovery needs? So a whole systems approach is essentially calling for a more comprehensive application of the biopsychosocial model of care.
We are putting forward that postpartum rehabilitation should be treated like a sports injury rehabilitation. There are many overlapping concepts that we can draw parallels from in the sport medicine literature and return to play injury models. So an example being the fear of movement. Fear of movement has been associated with poor return to sport following ligament injuries. We have also recently shown that in the postpartum population, women who have a higher fear of movement also have reduced chances of returning to running compared to those who have a lower fear of movement.
We're really passionate about making postpartum recovery and support something that is an active process rather than a reactive process. So we don't think that women should have to be symptomatic before they access rehabilitation for postpartum recovery. We think that the physical, psychological and social changes that happen with pregnancy and childbirth warrant an active rehabilitation process from the offset. And this is where this clinical commentary can guide you through the different factors that should be considered, which may impact someone's readiness to return to running. To further support physical therapists in helping women rehabilitate postpartum, we've created a supplementary document which Emma Brockwell, our co-author, will explain more about.
Supplement 1, titled Practical Considerations for Assisting Returning to Running Postpartum, discusses the potential benefits that supportive clothing may offer a woman's return to run within a biopsychosocial context. These adjuncts include breast support, compression garments, pessaries and footwear.
Because we know that taking that and implementing it into clinical practice can be quite difficult to do, we've created a supplementary file called Supplementary 2, and it takes the reader through clinical case scenarios whereby they can see the clinical reasoning process and that risk-benefit analysis that we went through to decide someone's readiness for running. In your clinical evaluation, you may identify physical and psychological recovery needs that warrant a woman to take longer in a recovery journey before getting back to high-impact exercise such as running. But equally, you could also identify physical and psychological needs that require the woman to return to running to address those needs. So if someone uses running as a coping strategy for their mental health, that's a really important factor to consider. If someone has issues with body mass, well, obviously we need to get them back to exercise, so it's figuring out the right level or right type of exercise for them at the right time. We hope that you find this clinical commentary useful and that you can apply it directly to clinical practice. Let's give women the same attention as we give to other populations within healthcare, and let's make moms fit and strong for purpose and protect their longevity with physical activity such as running.